we have this false sense of solving problems by reducing symptoms with powerful tools, but the tax that comes with that is the progression and more damage over time. My diagnostic criteria comes from really just having detailed conversations with patients, asking them about, what they've been through, what types of treatments they've received in the past. I think the earlier you get to conditions in the model that we work in, the more impact you can have on somebody's long-term health, right? Because we're solving problems before they become a really big problem. I always tell patients you can't unboil a hard-boiled egg, right? So the end stage of the degenerative process is damage to tissue, which progresses over time. And essentially, once we get to a certain threshold, maybe surgery is the only option at that stage of the game. So getting to conditions early is paramount to their long-term success. However, the biggest mistake I see people make, I talk about this a lot, is that when they develop pain or dysfunction or something that indicates to them that there's a problem, what do? We turn to short-term tools, right? We try to solve for the pain. And that really starts the process that we're discussing, which is that chronic and degenerative process, right? Because if we're solving for pain in the beginning and the condition isn't so significant that, maybe you have to go see your doctor to get a cortisone injection or whatever the circumstance may be, what that does is that sets us up so that down the road we will develop more significant issues. Here's what I mean. So like we reach maybe 35, 40 years old, we're an active individual, maybe we run a lot, maybe we do a lot of heavy lifting, and then all of a sudden we develop knee pain and it comes on relatively mild, relatively gradual. What's the first thing we do? Well, we stop what we're doing. We limit, the activity. We take maybe some ibuprofen or anti-inflammatories, and that tends to solve the problem, at least in the short term. But what we don't realize is that there is an issue underlying. So then we go back to our normal activities. 5 years down the road, now the problem becomes really significant. Maybe we have a really big flare-up, and now we have to pay attention to it. So we go to the doctor, they shoot some x-rays, and they say, okay, look, you got the beginning stages of arthritis, or you have a meniscus tear or something to that nature, where we can visualize the damage on film. And then what do we do at that point? Well, the doctor says, okay, I can give you some cortisone, and that should typically solve the problem. And, here's the thing. It does work. Like at the end of the day, it is a powerful anti-inflammatory, and it's enough to get patients out of pain. The problem is it doesn't fix problems, and believe it or not, cortisone damages and weakens tissue over time, right? So we know this. There's lots of studies. Journal of American Medical Association has done tons of studies on this, where it actually accelerates the degenerative process. So, we have this false sense of solving problems by reducing symptoms with powerful tools. But the tax that comes with that is the progression and more damage over time. So really, again, it's getting to things real early. And a lot of times, changing belief patterns in terms of our healthcare system is very difficult. Let's be honest, the prevailing healthcare system is a symptom-based system. And that's the one we have most access to. So we always end up going down that road to some degree. I tell patients all the time, the sooner we get to something, the easier the fix, the higher the likelihood that we're going to be extremely successful in an environment like this, because there's just not as much damage and it's not as chronic as it would be if we left it in place for 10 or 15 years. I think the consultation is underrated. I think the vast majority of diagnoses come from just the conversation with patients, finding out how things developed, getting an idea of the time frame. I mean, was there any trauma? Was there any specific events that precipitated any type of pain or issue associated with the part of the body that we're talking about? And then a physical examination. Obviously, diagnostic testing would be appropriate based on presentation. It really just depends on how the patient presents. But I think a large portion of my diagnostic criteria comes from really just having detailed conversations with patients, asking them about, what they've been through, what types of treatments they've received in the past, and then ruling out, any red flags and risk factors and those types of things, but then sending them out for the appropriate diagnostic tests so that we can clearly define where the damage is and where the problem's coming from. So really classic, just traditional orthopedic evaluation. And then with the mindset that, again, we have a different set of tools. So, if something comes back and it's, there's an unstable segment in the lumbar spine and they have really serious leg pain, they're not the right candidate for what we do. And we usually send them out to, surgical consults, right? Because some people need that. The house is on fire, right? We need to address the fire before we address anything else. But, for those individuals that are earlier on in the process, we can We can outline a methodology so that, they can achieve some level of long-term success. And, that will always include recommendations for nutrition. That will always include recommendations for lifestyle and how we can kind of get them from a holistic standpoint back to fully functional. If you know someone who could benefit from this information, please share the video with them. We're here to help.